Hello, my name is Aurora and I'm a cancer survivor. And this channel is about sharing tips that I have learned that may make life easier for others living with cancer and for their loved ones. And today I'm going to talk about something that is one of the toughest parts about having cancer, especially if you're an American. And this is the financial cost of cancer and having to take time off from work. In other countries, you're less likely to go deeply into debt due to medical bills and less likely to struggle getting time off. But in the United States, we have a whole different set of challenges. So if you have someone in your life with a cancer diagnosis or another major illness and you're not familiar with the cost, just as an example, my most complex surgery cost well over 350,000 US dollars. That's not counting the pre-op, the post-op, the medicine, or the recovery. It's just the actual day of surgery, $350,000. So luckily I didn't have to pay all of that out of pocket because I had really good health insurance. But this is the level of cost that we're talking about here. Most middle class people don't qualify for any financial assistance with cancer, and most of us also have trouble dealing with unexpected expenses in the thousands of dollars. So ultimately, the financial aspects of cancer can be really, really complicated and extremely stressful. So first, I want to share some things, some tips that might help you in dealing with the billing process. And it's important to note that while, yes, billing and finances in the United States when it comes to being ill at all, let alone with cancer, can be complex and frustrating. And there is a lot of political turmoil around healthcare and how healthcare is handled in the United States. And this isn't meant to um, dive into any of that or to say that our system is better or worse than other places. I have experienced the healthcare system in Canada. I have experienced the healthcare system in Poland. Um, each one has its pluses and minuses. There are things about those systems better than the United States, and there are things that are much better in the United States. And I am lucky to live here and very, very happy with the care that I have received here in the US. I don't think I could have gotten as good a care as I got here any place else, because I think the system of doctors and nurses and the research facilities that are available to cancer patients in the United States are really unrivaled. The research facilities here are phenomenal for cancer. But that doesn't mean everything's perfect, and it certainly doesn't mean that it's cheap. So I just want to get that out of the way, that this is not meant to be a political statement about the healthcare system. It's just more the reality of what will you have to deal with and what are some tips for being able to maneuver it. And there's no way I could fit all of those tips in a video that's half an hour or less. That's like several chapters in a book. But I just want to give a few tips that might make life easier. So first, I'll talk about medical costs and billing that will be true when you have any major surgery, including surgery for cancer treatment. And I'm not going to attempt to delve into the extremely complex process of medical billing and compensation, but rather just share a few tips that you may not know about that might prove helpful. So, one thing a lot of people don't realize is that in the United States, when you have met your annual maximum, no doctor is allowed to charge you anything for the remainder of the calendar year. For anything. They can only bill your insurance. So what is this magical annual maximum? In most insurance plans, there will be a cap on what you have to spend out of pocket every year. So let's say your annual maximum is $10,000. That means that once you have spent $10,000 out of your own pocket in a calendar year on healthcare, you no longer have to pay a dime for any covered cost for the remainder of the year. So I have had numerous doctors try to charge me for copays, co-insurance amounts, and durable medical equipment, and I have had to sometimes be a bit aggressive in reminding them that it is illegal for them to try and force me to pay after I met my annual maximum. They signed a legal contract with the insurance company in order to be in-network provider, and that means they're bound by that contract and they cannot charge me for any medical care, no matter what, once I have met that annual maximum, as long as it's a covered cost. So there'll be an individual maximum and a family maximum. If my family maximum is $10,000 a year, that means that if I have a 6-digit surgery, and that's really easy to do with cancer, then once I pay that $10,000, then no one who's on my policy has to pay anything for medical expenses for the rest of the calendar year. It's not just me, my whole family, they can't bill us for anything. So this is different from your deductible. Your deductible is the amount that you have to pay out of pocket before your insurance kicks in, before you can start using it. But the deductible does go toward your annual maximum. Your premium does not. Your premium is what you pay every month just to have the insurance, so you can have coverage. That you always have to pay. So if you are confused and you don't know the difference between your premium, your annual maximum, your deductible, your copay, your co-insurance, all of those things, I'll have a link below that explains what all of those terms mean. And so you can be really clear on what that is. You should have, your insurance company should provide you a glossary that explains what those terms are when you have your insurance. So you could also look that up, and I highly recommend doing so and reading through whatever materials they give you to know what your coverage is very clearly, because it may come in a lot handier than you realize when you have a major illness. It's important to know what your coverage is. Be sure that after you've read that policy very carefully and understand all of those amounts, that you assert yourself and your rights about what your coverage is. Often medical billing staff are poorly trained. They do not fully understand patient rights, and they are not likely to be very amenable to listening to you. If you're at a cancer center, you're likely to have more friendly billing staff than if you're going through a larger hospital that has a cancer center in it, but that's not specifically what they do. But either way, if no one is listening to you, you can contact the medical facilities risk management and complaint department, and they can be an advocate for you as well. It is much cheaper for the medical facility to help you than to be found in violation of the law. It's much cheaper for them to remove a charge from your bill than it is for them to get fined for doing something wrong. So be sure you know what your coverage is, what your rights are, what you can be billed for, and if a billing person does not remove a bill that's been put on your account incorrectly, you can contact the risk management or the patient advocate department or the complaints department, which every medical center is required by law to put that on their website, put the link to that or the phone number to that on their website, so you can find out where you can complain if you need to. Be sure that you do not get billed for something you should not be billed for. So that's tip one. Another tip is that a medical facility cannot hold an overpayment if they miscalculate your portion for surgery. So they cannot hold an overpayment. A sad fact of life in the US is that you cannot have a surgery until you pay your portion of the bill. So if your portion of a surgery is, say, $4,500, you cannot have the surgery until the $4,500 is paid. If you go into the hospital and need emergency surgery, that's a different story. But if you are scheduling a surgery, they will call you about a week beforehand and start asking you to pay your portion. and they won't give you a time for your surgery until 24 hours before the scheduled day. If you do not pay your portion before that 24-hour period, you will be removed from the schedule. And sometimes people will put off needed surgeries because they cannot pay their portion. However, because you will also be paying for pre-op checks and other healthcare needs, other people on your policy may have a treatment or other appointments, that means that the other people on your policy and the other things that you're having done, they are also going towards your annual maximum and your deductible. Because you have multiple things going towards that annual maximum and deductible from multiple places, it is easy for the surgical center to overestimate the portion you actually owe. So they can incorrectly estimate your portion and ask you to pay it because they won't be able to tell what you are paying for other appointments with other providers and what other people on your policy are paying for their providers. So they're not, the people at the cancer center won't know that you just paid $200 to go take your kid to the pediatrician because who knows what happened. Kids do stuff, crazy stuff, and get hurt and get sick and stuff happens. They don't know that. So that $250 is going towards your annual maximum and your deductible. Because it is so easy to overestimate your patient portion, you might end up with a credit on your account. This has happened to me a number of times. I have had a couple of providers try to hold on to those credits and not return the money to me. They say, oh, well, we'll wait until you have to pay again. And I say, no, you will not, because it's illegal. According to the American, or the Affordable Care Act, or Obamacare, but it's technically called the Affordable Care Act. According to the Affordable Care Act in the United States, the law states that any medical facility must return all credits for incorrectly estimated patient portions within 6 weeks, or they are in violation of federal law. The link to that is below. If you want to read that law and see what it says, and read that portion of the the Affordable Health Care Act and see what it says. If a billing person is being snarky and will not give you a refund of the credit on your account, you can remind them of this law. 9 times out of 10, they will be totally dismissive. They will be condescending. They will not give you the refund. That's okay. Just politely disconnect the call, count to 10, and go online and find the email for the hospital's complaint department. They have to post that publicly again, and then write a clear, concise email to that complaint department, or sometimes it's called the patient advocate department, and state that 1, your estimated portion was estimated incorrectly. 2, you have a credit on your account due to the incorrect estimation and you would like a refund. 3, the facility is within violation of federal law for not returning that credit within 6 weeks. 4, send them a link to the law. And 5, hit send and send the email. That complaint department they have always, for me, got my money back. The largest overpayment that I've had on my account has been almost $800. I don't know about you, but I'm not in a place where I could just let $800 sit for 6 months in case I might have to pay it again, or in case I might rack up $800 at this provider again. No, I need that back in the mix in my finances. I need that paid back to me. So don't back down, be polite, and I'll have a whole other video on how to advocate for yourself with billing staff, because that's a whole situation all unto itself, is just talking to the staff. But just stay polite and calm, send that email, and get your overestimated portion back. Also, it is better to strike up a deal for a payment plan than to put off your surgery until you can pay your portion. So based on the advice I just gave, if you find yourself in a position of having to put off a surgery because your estimated portion is unaffordable for you, even if the hospital doesn't tell you that it's possible, most of them will offer you a payment plan if you ask. And if you have cancer, many hospitals have a um, assistance program that can reduce your bill overall so that you have to pay less overall. So you could have a bill reduction, you could have a payment plan, you could have parts of your bill written off. You just need to ask. Ask your cancer care team, and also ask the billing department. Um, you, in addition to the internal care center, and ask your surgeon, ask your cancer care coordinator, let everybody know that you need assistance, and find a way to be directed to whatever program they have to help you get on a payment plan and get some assistance with your bills so that you don't have to put off your surgery. Another important thing to consider is accepting financial help. So even people that have insurance can easily get overwhelmed by medical costs with cancer and other major illnesses. So after you've met your annual maximum, there will still be costs that are not covered by insurance for support items, like some of the items I've covered in a previous video, for special dietary needs, for post-surgical clothing. Even if you happen to have an HSA or a health savings account, it is likely that at some point costs will exceed your monthly contribution to that HSA, and you will just have to pay out of pocket. And so even with great medical insurance, you can still end up paying thousands of dollars for your care. And when you are overwhelmed with costs, the idea of help can seem like a beacon in a storm. But there are some things that you should consider. One is, do not hang your hopes on cancer assistance programs. There are programs out there, both through hospitals and through nonprofits and cancer support programs, that can help pay the bills. But the reality is that very few programs are truly accessible to all cancer patients. Even the assistance programs in highly reputable institutions are often overwhelmed. They don't have enough resources for all the patients that qualify to receive help. There are tons of support programs for people with cancer, including co-payment relief programs, and I will do a separate video that focuses on that. But I have never found a program that will give someone the tens of thousands of dollars it can take to recover from and live with cancer. It really does impact every last part of your life. And the odds of those programs lifting you out of dire financial straits are slim to none. So don't hang all your hopes on assistance programs, whether it be through a hospital or through a nonprofit. I think St. Jude's is the only hospital I know of that makes sure all cancer care is free, and that is for children. So if you have a child with cancer, then you're in a little bit better shape. But as an adult with cancer, there's just not going to be a lot that's going to cover all the costs. If you are a loved one who's trying to help with costs, be careful when giving large donations for expenses to someone that you love. And be sure that you set boundaries with anybody who's wishing to give you a loan or personal funds. If you're the one receiving the loan, be careful about personal boundaries. I'll talk a little bit about that in a minute, but going back to being careful about how you donate money to people that have cancer and how you give money. In the United States, a lot of people worry about whether they have to pay taxes on gifts that are given to them. It's not the receiver that pays the gift tax, it's the giver that pays the gift tax. However, in order to be taxed on a gift, you have to give more than $15,000 in a year to trigger that tax. And most people don't have that kind of money to give. And that amount will change every year. At the time that I'm saying that I'm making this video, I think it's $15,000 for a gift tax, but it'll go up every year. So by the time you see this, it might be more than that you would have to give to trigger the tax. And you don't pay tax on the whole thing. You only pay tax on the amount you give over the $15,000. So if you give $16,000 to somebody for a gift, or you pay a bill for them that is $16,000, you only pay tax on the $1,000 that you that's over that limit for the gift tax. So there is a tax on giving large gifts to people. However, most people won't have to worry about it, but if you do have that amount of money and you want to help out a loved one who's ill, say you decided to clear out your retirement or something like that, or who knows, maybe an inheritance, or maybe you're just lucky and you're rich. I recommend contacting your accountant to make sure that you follow the correct steps to pay that bill, because if you are paying someone's medical expenses, you might not have to pay the gift tax at all. The trick is that you can't give the money to them. You have to give the money directly to the medical facility. So let's say my niece got cancer and I have tons of money and I want to pay $25,000 towards her medical bills. Then if I did not want to get hit with a gift tax as the giver, I need to pay that directly to the medical facility, not to my niece. And I will contact your accountant if you have that large amount of money that you're wanting to pay someone's medical bills with. Make sure that you're doing it in such a way that the money you're giving is all going where you want it to go and not to something else, and that you're not getting taxed on it. Something that people don't often think about when accepting a gift that I mentioned a few minutes ago is boundaries. The thing about a gift is that once it's given, the giver shouldn't expect anything in return for it. Otherwise, it's not a gift. It's a loan or an exchange. So if you give someone a gift, be sure that you're comfortable with the fact that the money that you're giving, the user or the receiver has the right to spend it as they see fit. It's not, you don't get to control how they spend it. If you're just going to give them cash, remember that the cancer patient is the one who knows their needs best and their family's needs best. And so they're the one that get to decide how to use that gift. Sometimes when we give gifts, we don't realize that we attach expectations to them. Like maybe if you paid for your kids' medical bills, then they should include you in the medical decisions. Or if you pay for repairs on their house, then maybe they'll owe you a favor later on. Or maybe they'll use your cousin who's a plumber to do the repairs on their house or whatever. Those kinds of expectations, when they're not clear and everyone doesn't understand what they are, those can damage friendships beyond repair. So it is really important to be honest with yourself about why you're giving the person the money and what strings you are attaching to it, if any. And make sure that if there are strings attached and you feel really strongly about those strings, that you are really, really clear about that with the person you're giving the money to, so they know what they're getting into when they receive it. And if you're the person receiving the gift, remember that the giver may not be doing any of the above. They may not be telling you anything. They may not be clearly communicating with you any expectations they have. And they may be thinking that that gift entitles them to something that you do not want to share with them. So it's really important as the receiver to set your boundaries up front. So that means saying things like, thanks, I so appreciate you helping us pay our portion for this surgery / this month's mortgage / kids' tuition or whatever. I just want to make sure that you're okay with the fact that we won't be able to pay you back. Thank you for helping us with this surgery. We're still going to do whatever it is you're going to do for recovery. We're not going to do the thing you picked. So sometimes saying those things can be a little bit awkward, but in the long run, it will mean less stress because everything's out on the table and everybody understands where you're at. So while that was by no means a comprehensive list of things about billing and finances, hopefully those are just a few tips that can help save you money, and help you with the billing process so that you don't get overbilled or overpayments don't get held, and just help make life easier for you as you navigate the experience of having cancer or other major illnesses. So I'll see you next time with some more tips, and until then, stay healthy and take care of each other.